Catawba Valley Medical Center in Hickory serves the greater Catawba County area, as well as the fringes of Iredell, a little bit of Alexander County and Lincoln County, primarily. The medical group, however, has offices in Taylorsville, as well as 15 locations in the greater Catawba County region. Several urgent care locations, as well as 4 specialty practices. In the new era of healthcare reform and delivery system adaptation to that reform, that value is the key. The arrangements that we're looking at through CHESS will enable our group to participate in just about any scheme or other arrangement that's made, whether it's with the federal government, with Medicare, the state through Medicaid reform, or private insurers that are going to be entering this new marketplace of the future. We do believe that we will get there. We're not sure how long it will take, but we do believe the transition is probably the most important period in our history. To be able to come out on the other end in the new era of reform and whatever that looks like. Getting from this point to that point is a critical path we have to take. And again, the relationships with CHESS, Wake Forest, Cornerstone, we feel very, very positive that is the right path and the right people to be walking down the path with.
Wake Forest Baptist Medical Center is an academic quaternary tertiary medical center located in Winston-Salem, North Carolina. It's a level 1 trauma center and a certified burn center serving a 19-county service area in the Piedmont Triad region. It is part of the Wake Forest Baptist Health 3-hospital system and is nationally ranked in 4 specialties. It has 885 beds and in the last fiscal year had 36,000 patient discharges. Part of our engagement with CHESS is thinking about how we uniformly deploy evidence-based medicine and protocols across a large set of diseases and patient populations that we serve. So using their analytic capabilities and new sets of claims data that we've been able to receive, we're now risk stratifying our population, identifying our high-risk patients, deploying different care models including health navigation, care management, and our patient care advocate program to close gaps in care. And that allows us to more uniformly and consistently manage patients across a same set of evidence-based measures so that we have more consistent and better application as well as prediction of cost of care and outcomes so that we can predict how well we will do in our value contracts. With the help of CHESS through their video series that we'll be deploying down to our service line and really sort of beginning to make sure that each element of what the move to value means to our providers and seniors team. It's more than just succeeding in a gain share value contract. It's really about improving the patient experience and achieving the highest quality of care we can for our patients. And Wake Forest has selected CHESS to be its partner on this journey to value-based care.
Cornerstone is a large multi-specialty group that was formed in 1995, originally in High Point, North Carolina, and now we've grown to currently more than 300 providers spread throughout central North Carolina. We've spent 3 years putting new care models in place to be able to take care of the entire population that we serve and reach out to patients rather than just waiting for patients to walk through our doors. And that's a big part of what we do in terms of population health. We have care models, we have nurse navigators and patient care advocates who reach out to patients and manage their health rather than just waiting for them to show up, and usually by then they're a lot sicker than if we try to reach out to them and get them the care they need ahead of time. One of the steps along the way in terms of the whole transformation was to become an accountable care organization, but we always knew that that was a stepping stone. We very early on put in put in shared savings in all of our commercial contracts, and then starting in 2015 we now have several contracts that are full risk, and that is what we see as the end game, since we already know that we do take very low cost, very high quality care of our patients. And so that is our ultimate goal, is to be able to control the destinies both of our patients and of our organization, so that we can take care of those patients for the long term. Most healthcare providers in the United States these days provide high quality care. But part of the challenge is to prove that you provide high quality care, and also be able to identify the parts of the care you provide that perhaps are not as high quality as they could be, and also to make sure that we're reducing any outliers that are not following the standard of care. And so that's been the most important investment that we've made. The CHESS IT team has really helped us, and now we have very mature analytics in place to be able to look at cost of care, site of service, as well as the overall quality of care. We have very mature, developed metrics that we call the Pathway to Excellence, that we're able to measure individual providers as well as service lines in terms of achieving quality of care, and that has led to us being ranked as the 25th top ACO in the country. Going forward, we've already been able to show that especially within our particular care models, we've been taking care of under 3,000 patients, and we've already saved over $8 million in terms of reduced hospitalizations and reduced emergency room visits. And that's a very small percentage of our overall population. So as we expand those care models and are able to take care of more patients within them, then we certainly expect to see those kinds of savings multiply. Also, because we are one of the first organizations to be making this kind of a transition, and of course now we've been validated that we've chosen the right road, we would hope to be able to expand our ability to care for more patients in the area, and also both through Cornerstone and then also through CHESS help other organizations to make these types of transitions hopefully a little smoother. Hopefully we've learned a few lessons along the way, and we can help other organizations to make this type of important transition.